Here you will learn everything you want to know about red light therapy, plus more very important things you want to know long ago. I spend a fair bit of time studying the science of light therapy. I feel the need to speak up. There are over 7,000 studies on light therapy, the majority of them on red light, with infrared being a second close. Light therapy is done with both lasers and LEDs. The concept of LEDs being too weak was debunked years ago. That led to an explosion in the consumer light therapy market. The reason LEDs work as well as lasers is that by the time the photons reach the body, there's no biological difference between an LED photon and a laser photon. The columnar aspect of the laser light falls out of the equation when the laser light hits the skin, because the skin is much more reflective than had been assumed. When you do light therapy with a low-powered laser or LEDs, it's called cold laser, low-level light therapy, or low-level laser therapy. The keyword used in science is photobiomodulation, i.e. using light to change the biology. Red light therapy usually includes infrared light, and most consumer devices are a combination of red and infrared. Red is good for skin, pain, arthritis, and hair growth. Infrared has a deeper reach into the body than red. Infrared is good for pain, arthritis, inflammation, healing poorly healed fractures, and brain modulation. Blue is especially helpful in reducing the symptoms of acne. Presumably because it's close to the UV wavelengths, it has the ability to kill the P. acnes bacteria in a completely non-invasive manner and with no side effects. That is granted that the person wears goggles, as blue light can hurt the eyes and definitely blocks the production of melatonin. 810 nanometers and 1070 nm are approximately the strongest wavelengths in that they have the deepest reach into the body. Most successful brain studies are performed with 810 nanometers and 1070 nm. The most exciting work in red light therapy is using 810 nanometers or 1070 nm along with a 10 Hz or 40 Hz pulse. Subjects with dementia, traumatic brain injury and Parkinson's show significant gains when treated within these parameters. The infrared wavelengths have the deepest penetration into the brain. The frequency pulse entrains the brain waves to 10 Hz or 40 Hz, corresponding to alpha rest and gamma alert. The most popular use of red light therapy is anti-aging devices such as light domes and face masks. These usually offer red and infrared light, and can also be found with blue and yellow light. Blue combined with red is the best combination for acne symptoms. The blue kills the bacteria and the red, ironically, reduces redness. Each on its own can reduce bumps and lesions. Red and infrared can reduce scars. Yellow also has a red-reducing effect. Red and infrared combined are the best lights for producing collagen and elastin, thereby reducing wrinkles. The biggest challenge for the red light buyer is dosing. Successful treatment requires that the wavelength and energy quantity fluence fit within a therapeutic window. Marketing and non-medical people being in charge of writing product descriptions allows the market to get very confusing for the buyer. Vendors fight to outdo one another to the point that now every light on Amazon supposedly has 100 milliwatts per square centimeter irradiance when holding the device on the skin. Some claim 200 milliwatts. The consumer has no way to know if these values are accurate. This is a huge challenge that the industry has to fix, because the wrong dose of the right wavelength doesn't produce healthy change. When the mitochondria absorb the right amount of photons, the body kicks off an ATP production cycle using the photon energy absorbed. Yep, we're like plants. Light received changes drastically with distance and time. If the customer uses the wrong distance or the wrong treatment time per session, he or she will fail to see gains. The healing starts when the absorbed wavelength reaches critical mass. Healing continues as photons come in. When the bag is full, healing stops. If the light continues to shine on the same spot, healing reverses as if the therapy had not been done. So it's essential for consumers to use quality vendors who actually test their lights with proper equipment. I hope this clears up some misunderstandings about red light therapy. I'm a bit obsessed with the subject, so please feel free to ask me questions. I originally bought a red light device to get that collagen glow, since red light is known for stimulating collagen production, and collagen tightens and firms the skin and overall makes it look amazing. Was skeptical about it at first, but I thought, what's the risk? I established a routine of using the device for 10-minute sessions before bed a few nights a week. As of today I have been doing it for about 2 months and the results have been astounding. I just wish I took before-after pictures so I could show you guys. My skin looks younger, firmer and tighter, and my old skin hyperpigmentation is very hard to see now because my collagen literally pops out. Now maybe I'm just an outlier, but I want to know, has anyone here also seen insane results from RLT? I'm definitely considering using this long term. To be honest, I've used red light therapy on my face with the eye goggles on for about 3 months, and one thing that I've noticed recently is that a long black floater that's been in my left eye for decades is no longer there. I do all these things and experiments not just for myself, but also to help people. I would say it's 100% worth the investment. I have the current body one, and within 2 weeks I noticed my redness calmed down and my skin was much more radiant. I also experience less bumps. Within 3 months using red light, I have noticed that my ice pick scarring has also faded quite a bit. I can't say enough good things about red light. Before you buy it, encourage you to learn about the difference between near-infrared light versus just red LED, and also to consider buying a tabletop or other hinged style panel versus a mask for multiple reasons. The price difference between near red light combo versus just LED red light alone is huge because only near can penetrate the skin to the depths of generating collagen in tandem with LED red light. Looking at $150 to $200 price difference whether it's a red LED mask or panel. To get the full benefit you need near-infrared and red LED bulbs. This is why you see the multicolored and red LED only light masks and panels are only a quarter or less the cost of a proper near panel that traditionally used to only be available in the dermatologist's office or tanning salons with infrared light booths. The panels work more than 4x more effectively than the face mask bulbs. And it has to do with power supply, the light count and the ratio of near bulbs. Expensive to just red LED bulbs. Less expensive, these make up the vast majority of almost all red LED masks or devices. I theorize that if having the near red LED therapy masks is going to be the critical difference between an individual ending up ever using or utilizing it on a regular basis, there's sufficient reason to suggest that during these treatment periods you may only find it practical or enjoyable if you are able to move more freely and not stuck to the panel. At the same time, you really don't need to spend more than 8 to 12 minutes facing the panel at a given time. It's cheaper than a mask and has better output. I will say there is a good reason to use masks though. If skincare is your only concern, dosage is set because yes, you can overdose. And sometimes more isn't always better. Near can also cause melasma in some people. I myself can't use near on my face. If you want maximum power and customization, go with approximately 2 minutes daily in front of a Mito, Platinum LED, Puga, etc. panel and adjust upward as needed. Stopping at 10 minutes body part is a max. That is an insane skin dose with some of these panels these days. If you want to not think about dosage, etc., grab a mask and use as instructed. Lower power aka longer time in minutes daily, days of use to see results but lower effort. I slow down my speech sometimes so you can understand me properly. I really want to help as much people as possible,